This is a developing story of national and global significance. COVID-19 cases are seeing a gradual uptick in India and also around the world. The virus seems to have mutated, but our collective alertness must not diminish. We have Dr. Rommel Tickoo, who is joining us on the broadcast. Dr. Tickoo, thank you so much for waiting on patiently. There are some concerns that are being raised by people who are now aware of the certain rise in COVID cases in across a few cities in the country. Is this the time to panic? What is your word of advice for people?
Well, there has been a spike in the number of COVID cases across Asia and even in our country, whether it's Mumbai, Chennai, there's been a spike in the cases. Delhi has had some 23 odd cases, but there is no need to panic at all. It belongs to the same Omicron family, the JN1 variant and its descendants, and the symptoms are more or less the same. Whatever cases we've seen till now are mild cases. Most of them are recovering at home. There is no evidence to say that this particular variant is more virulent, leading to more complications like hospitalization and death. Yes, it has immune evasion properties, which basically means if you have immunity, you might still get infected. It is more transmissible, but we can manage. From our side, we have to be vigilant. Increasing surveillance is the need of the hour, and the authorities are doing that. All positive cases need genomic sequencing so that we identify the new variants and take all the precautions.
Yes.
From our end, the hospital beds, the ICU beds, whether it's the drugs, ventilators, by everything has been taken care of. And we have to be vigilant and we have to take all the precautions. From our end, we have to wear masks in crowded places, public transport, wash hands, follow the COVID protocol. Whatever evidence is there till now with us, there is no need to panic at all. Very unlikely that it will lead to a huge spike in cases, which will lead to increased hospitalization and death. But yes, at some point we have to raise the bar and be very vigilant. Look at the other countries, Singapore, Hong Kong, they've had a spike in cases. But again, looking at the overall picture, things seem to be pretty good at the moment. I don't think there's any need to panic. Yes, but we need to be more vigilant.
All right. Viewers, Dr. Rommel Tickoo is the Director of Internal Medicine at Max Healthcare. And, you know, when he is quelling all the concerns that you have, then you know there is no need to panic. Dr. Tickoo, is there something about the JN.1 strain that our viewers should be aware of? Because in this day and age where all kinds of information floats around on social media, what is the right kind of approach to the kind of information that's coming in with regards to the strain?
Well, it's not very different from the previous variants. It belongs to the same Omicron family. Its descendants also lead to the same kind of symptoms: fever, cough, sore throat, and there's no specific treatment. It's all self-limiting. Most of the patients get better in 5 to 7 days. And regarding this particular strain, there is no evidence to say that it leads to increased complications, pneumonia or death. Yes, it is more transmissible. Yes, even if you are immune to COVID, you might still catch it, but it won't lead to hospitalization. So nothing particularly great about this strain. But yes, because it's a new strain, because mutations keep happening, this virus keeps evolving, so we have to be at our guard. And increasing genomic sequencing is being done so we catch these variants in time. So again, I would stress on the need that if you are sick, if you have a flu-like illness, just stay at home in isolation. Don't spread it to others. And take all the precautions. We still don't see many people wearing a mask, especially if you are vulnerable, if you have comorbidities, if you are a diabetic patient, if you have a heart disease, if you are immunocompromised or a cancer patient, the chances of you getting a bad COVID are more. So this population particularly needs to be more careful and take all the precautions. And maybe at some point we might need a new vaccine, a booster at some point, which includes this particular variant as well.
Right. Doctor, you mentioned the booster, but presently, how effective is our vaccine coverage in protecting against, COVID at this point of time?
See, majority of our population was infected with COVID. And again, majority of the population was vaccinated also. We have good amount of immunity against COVID. But having said that, we can still get these variants, have immune evasion properties, and they can still infect you. We won't have a severe disease. But see, we don't have too many cases. We have hardly seen COVID in the last couple of years. It's more become like a flu-like illness now. But if there's a surge in the cases, if the cases go beyond the roof, which is unlikely, but if it happens, then yes, we might need a booster at some point, which includes these variants as well, because they were not part of the initial vaccination which was being done.
All right, Dr. Tickoo, another word of assurance. I know what you've just said right now. Is assurance enough for all those who are watching this broadcast that right now is not the time to panic? It is important to remain vigilant. Those simple habits that people should always keep in mind and should focus on instead of, allowing any kind of fear to perpetuate. What is that one advice that you'd like to give people who are listening right now?
Just wear a mask when you're in crowded places. And if you have a flu-like illness, stay at home for 5 to 7 days. Don't spread it. That's all. If you do this much, it would be great for us. We won't be able to spread this far and wide.
Thank you so much, Dr. Tickoo, for joining us on this broadcast and also for answering the queries that our viewers have had and for also quelling all those concerns. With that, viewers, it's time for us to take a short commercial break. But remember, stay alert, do not panic, follow the basics, take precaution, the most simple ones. Taking a short break.